Okay, friends, today I want to describe you what you can see in a self-prostate examination. So I had a video telling how can we do prostate massage to ourselves, and in this video I try to explain that the way of doing a prostate massage to yourself. Actually, only half of the patients can do this because we insert the finger from our rectum and we try to touch the prostate, but reaching to prostate is not possible for half of the men because of their finger length, because of the distance between prostate and the anal sphincter. It differs from patient to patient. Anatomy is different in every man. So I noticed that people are dealing with this just to understand their anatomy and the possible disease, to find out possible diseases. We use prostate massage for the treatment of prostatitis, nothing more. But in prostate we have such diseases like prostatitis, benign prostatic hyperplasia, prostate cancer, prostate abscess, and prostate stones. Actually, the massage only works for prostatitis, to get rid of infection, to drain the infection inside the prostate. So if you do a prostate examination, what can you find? First of all, I have to say, this is not to replace a urologist. You have to go to urologist after 50 years of age to find out your prostate status. You have prostate diseases, benign prostate hyperplasia, and the prostate cancer is the most common two disease, and only a urologist can make an accurate diagnosis. And also he will need PSA value or your blood value. But when you are at home yourself, why not feel your anatomy, examine your prostate, insert a finger from the rectum and see what's inside, because sometimes you can really feel some diseases in the prostate. So this is prostate. When we put our finger and push it, we pass this part which there is nothing, and then we hit a chestnut shaped organ, and we can understand some diseases there. Okay, first of all, to define these diseases, what's prostatitis? Prostatitis is the inflammation of the prostate gland, usually caused by a bacterial infection or any kind of inflammation. There may be some inflammations or infections inside the prostate. Let me show like this. Inside the prostate, some bacteria may come and it may affect some place here. Then it may grow bigger. And this side of the prostate may be distracted because of the infection. Then when antibiotics come and cure this, sometimes it is not enough for the prostate itself to drain this inflammation out. This is why we do prostate massage. So sometimes we see a lot of parts of the prostate is inflamed, and we squeeze the prostate to get rid of this infection. The second disease is benign prostatic hyperplasia, a non-cancerous enlargement of the prostate gland that can cause urinary symptoms such as difficulty in urination and frequent urination. Why it happens? Let me show you. Okay, normally there is a urine channel inside the prostate, which the urine collected in bladder go through prostate, and it's drained, it's flushed out from the body from urethra. So benign prostatic hyperplasia means the enlargement of these tissues without cancer, and it squeezes the urethra, and what happens is, so there is squeeze of the urethra inside the prostate, we call it prostatic urethra, and there is difficulty in passing of the urine. So this is benign prostatic hyperplasia. We can also understand this when you put your finger inside, you will see an enlarged gland. So how will you understand it is enlarged? Normally prostate size is like a chestnut size. It is, let's say, 2 centimeters or 3 centimeters, this shaped organ. If you feel a bigger one, like an apricot, or like a mandarin, it's big. It must be in chestnut size. Or if you feel something very big, like an orange, it's very big. So you can understand you have an enlarged prostate with putting your finger from rectum, advancing it through the inner side, passing this part, and you will touch to this. If it is like a mandarin, it is enlarged. If it is like an orange, it is too much enlarged. So you have to be careful about your urine flow. If urine flow is decreased, if it is weak, that means you have benign prostatic hyperplasia. So you can understand this with self-examination too. Okay, third disease is prostate cancer. When you put your finger inside, when you touch your prostate, you may feel something abnormal. What do you feel? So your prostate may be in a normal size, not big, but you may feel some nodules, some very hard, stiff tissues inside your prostate. Okay, we are educated in the schools like this. This is your thumb. Close it to your index finger, squeeze a little bit, so this part becomes stiff. This is the normal stiffness of a benign prostatic hyperplasia. So when you press it, you can understand how you have to feel during your self-prostate examination. This is the normal stiffness. If I give it a little loose, this is like an infection, prostatitis. If I compress it hardly, this is stiff, this is benign prostatic hyperplasia. Here, if I push this bone here, this is the stiffness of the cancer tissue. So when I advance my finger in the rectum, I will hit a tissue like this. I will look it, press it, it must be like this. But if I feel something bony hard, they may be usually some small nodules, 1 centimeter, half centimeter. This may be a sign of a real serious abnormality. So directly run to your urologist. Sometimes they are bigger. So this is an advanced disease. You will feel it when you advance your finger from the anus. You will touch to your prostate, and then this is the normal tissue. And if you feel something like this, this is the cancer tissue. Of course, it has to be proved by a biopsy, and your doctor will do a PSA test for you and will biopsy it if needed. But you can examine yourself and understand if there is any abnormality. As I said, half of the people. Okay, the other diseases are prostate abscess and prostate stones. Still, when you advance your finger, if you feel very loose tissue, very loose, and when you press it, if there is too much pain in your urethra and your penis, that may be a prostate abscess. So you have to go to your doctor again. And prostate stones, you feel them very similar to prostate cancer nodules, but still, if you feel something abnormal, it's not diffuse, homogeneous. If there is some abnormality, you are touching something wrong, go to your doctor. Okay, so as a summary, I don't say you can replace a urologist with examining yourself, but why not? When you are sitting at home, everybody can examine his testicle, women can examine their breast. Why not examine your prostate and be aware of your anatomy? So in prostatitis, you will feel inside a soft, here our example, softer, spongy, and when you press there will be pain in urethra and penis and discomfort. This is what you feel in prostatitis. In benign prostatic hyperplasia, the organ size will not be this size. It will be bigger, sometimes really big. It's enlargement of the prostate hyperplasia. If you see it, go to a doctor and ask for advices, because when it is enlarged, when the urethra squeezes, there will be difficulty in passing urine and bladder functions will be deformed. So in prostate cancer, here soft, firm tissue, but sometimes you will feel a hard nodule on this. go to doctor. And prostate abscess, same as prostatitis, but it is a more advanced stages of the prostatitis. You will feel pain when you touch here. There will be extreme pain and spongy tissue. And prostate stones, they are formed because when the inflamed parts are healed, sometimes calcifications gather in these parts, and stones are like cancer tissues. They have nodules. You will feel this nodular part, and in this case, again, ask for a urology consultation. So these are not to replace the urologist, but be aware of yourself. Have a nice day to you.